This was another really cool case where the instructions said to close the vertical dimension on the lower arch by 6 millimeters and shift the midline by 1 millimeter. So when we pull up the reference, you can see that the base was pretty heavy on the lower, and the maxillary anterior teeth were in the correct spot from an incisal point of view. You can really appreciate also that the plane of occlusion drops on both sides. So when we pull up our preview, you can see they maintain the vertical position of 7 through 10, but they have raised the plane of occlusion in the posterior to correct the curvus B. And then when we pull up the lower, you can appreciate that we have closed that vertical by 6 millimeters. And so if you pull up the measurement tool here, you can measure from the base, which is the bottom in the purple, up to the pink, that's now a 6 millimeter difference. So we have closed vertical dimension 6 millimeters and shifted the midline over. Because this is such a significant change, this is not one that you would want to go directly to final. This is one where you would want to do another monolithic trine. So this patient will receive a second monolithic trine. This is another exciting one. So this is one where we obviously missed the CR at our last try-in. And so you can see that we have anterior open bite, some posterior cross bite, and we have asked them to idealize the occlusion. And so now when we look at our setup, they have once again raised those mandibular anterior teeth to fill in the gap without closing the vertical. So I have a feeling we're going to have another one that is open at the vertical if you look at the height of those mandibular teeth. So we're going to certainly ask the lab to close the vertical a little more. They've already closed it some. The other concern I have specifically with this case, when we turn off our reference and turn on our teeth, we have a crossbite, a unilateral crossbite. So, and if you look, we have the teeth set very close to the ridge on the maxillary, on the up on the maxillary left, and they're kind of further out on the maxillary right. So I'm going to have them reposition the teeth on the right by tilting in the mandibular posteriors and moving out the maxillary posterior so that we can correct that crossbite. When I pull up the intaglio view, you can see we've already closed the vertical by 2 millimeters. So I might just have them close it one more. So I think that we are getting there slowly but surely. But again, this is one where you want to look at the reference and kind of see where it is. Because if you don't look at the reference and you just look at this, then you might not notice that change in vertical dimension on the lower. And then when you look at the crossbite, you might think it has to do with the anatomy, but when you pull up, it doesn't look like there's as much of an asymmetry in the patient's ridges as it looks like with a tooth arrangement. So we will decline, and please reposition. So this is a follow-up from the case that we declined earlier. And so remember, we saw that this was a patient that the original reference was had that anterior open bite, and they pulled the teeth up to close it. So once you have modified your setup, now we've lost our original reference on here. But now when we pull up our full setup, you can see they've maintained the occlusion, they've maintained the aesthetics, but we've now closed our vertical 2 millimeters. So this should provide a better vertical dimension. And so if we pull this up, we should be able now to measure from top to bottom and be close to 40. Okay, so we are at 44 millimeters, but the lower arch is at that ideal 18. So we might have a little more anterior tooth display, but that was approved by the student previously, so hopefully it will look good, and now we will approve it. This is another interesting one where this patient actually liked the way her dentures fit and looked. And so this was a definitive set of dentures, but they were made with a flat plane occlusion, which you can appreciate from kind of these lateral views. and she had quite a lot of horizontal overlap. And so if you look, there was just not a great interdigitation on the maxillary mandibular teeth. And so the patient felt like she couldn't bite anything. She couldn't engage that bolus. So we asked for no changes aesthetically, but we wanted to make sure that we had switched to a semi-anatomic tooth with a nice cuspal interdigitation so the patient could improve her chewing force. So now when we turn off the teeth, you can appreciate we've switched to a semi-anatomic mold on both arches. So now we have nice cusp height, and when we pull in the teeth, we get that nice interdigitation on both sides. So we don't have that horizontal overlap. We have a much better cusp to fossa relationship that you can appreciate here. So we'll approve this one. With this case, it was a little different than some of the other ones we've seen. It looked like the entire arch, maxillary arch, was rotated slightly to the patient's right, resulting in a little midline shift a little bit further to the patient's right, and it made it almost look like the teeth were sticking out on the patient's left as that arch kind of rotated around the axis, if you think about the midline of the patient. So when we wrote our notes, we asked them to rotate the arch to the patient's left, and somehow it got rotated even further to the patient's right. So when you look here, the purple represents the original arrangement and the white is the new tooth setup. You can see the midline is now further to the patient's right. So we have a lot of work to do with this one. So we actually logged in and started moving some of the teeth around a little bit to try to get better incisor display and try to close that arch somewhat so that they don't have as much space between the maxillary anterior teeth and the mandibular anterior teeth. So you can actually log into the Avident system, this is web-based, and rearrange the teeth either one at a time or one arch at a time, or you can move them symmetrically as well, or you can just move the anteriors. So this is a really cool option if there's some changes you want to make that are minor and it's easier to move them yourself rather than to communicate to the lab. So here we're going to move the teeth around a little bit, and then we'll communicate the last changes about shifting that midline with our notes. So once we're done, we say yes, and then they process the occlusion.